The thing we are lacking is collecting the data across the country so we have an idea just how much additional support is needed.
Over the course of the pandemic, concerns have been raised about the mental health challenges youth are facing. Now, experts say there's not enough screening tools to properly assess the severity of the problem. Emily Grunwald, President and CEO of Children's Healthcare Canada, says the pandemic has impacted children on three fronts. First, through prolonged disruptions in in-person learning. Second is disruptions in their ability to access timely health services. And third is social and physical isolation.
We were hearing 48% of parents will be seeking out mental health services for their children for the first time as a result of the pandemic. And so that's a significant increase in demand for children's mental health services, and we just don't have the capacity right now to meet that demand. We're also seeing numbers as high as 64% of parents acknowledging that the pandemic has made mental health challenges worse for their children.
Grunwald also says across Canada's 13 children's hospitals, there's been an increase in hospital visits and admissions related to anxiety, depression, eating disorders, self-harm, and addictions. She says it's a challenge to measure data across hospitals in the country because there isn't a consistent way to measure patients and their acuity.
That if you wanted to have sort of just a common metric or a common measure of what are people's mental health needs and sort of how urgent are they, there is not one single tool that we have developed. If you don't measure, you don't know. That's what I would say in a nutshell. So, if we don't collect the information using standardized tools or something that's, again, reliable and something that we know what we're measuring, we can't really know the health of the nation.
Chris Wilkes, an advocate for the Canadian Academy of Child and Adolescent Psychiatry, says that there's good data collection, then they can provide the appropriate service in the areas that are needed.
We want to try and provide evidence-based treatments for children and adolescents who are struggling, as opposed to just containing, admitting, or reassessing and then sort of discharging back home. We want to make sure that they're getting the right treatment for them at that particular time.
These experts say they do look forward to working with Carolyn Bennett, Minister of Mental Health and Addictions, who has prioritized mental health standards in her mandate letter. In Winnipeg, Breanna Marcelo, City News.